Assalamu alaikum. My name is Sayyida Hamna Wasim and my roll number is BP1450188. I belong to group number 27 and my topic is tyrosine kinase inhibitor interstitial lung disease. First, we come towards the introduction of tyrosine kinase inhibitor interstitial lung disease. It is the most common cancer in the world. Like it has gefitinib, afatinib, or creatinib that provides significant benefits to NSCLC. It is also has positive epidermal growth factor. Okay. It is the most serious complication. Interstitial lung disease is the most serious complication of TKIs. It usually occurs with cough, fever, or acute dyspnea, and patients of ILD need to be hospitalized. Yes, respiratory is failure too, and its occurrence is 1/3 of cases is fatal. Diagnosis of ILD: subacute or acute progressive dyspnea with or without cough, and yes, fever, sometimes not fever. Exclusion of pulmonary infection. Radiographic findings show bilateral diffuse or patchy intestinal or alveolar obfuscation without evidence of marked progression of lung cancer. Pathological findings consistent with ILD are also there if it is available. If we talk about high risk factors, so it is high risk in male sex, and smoking, the patients who smoke, and the patient who have history of pulmonary fibrosis. Now we talk about tyrosine kinase inhibitor function. They are pharmaceutical drugs that are responsible for the activation of many proteins. They are activated by adding a phosphate group through a process known as phosphorylation. These are also used in cancer patients, so it is also known as anti-cancerous drug. In phosphorylation, it do not inhibit protein kinase that phosphorylates serine or threonine that residues and can discriminate between the kinase dominant. TKIs operate by 4 different mechanisms: that adenosine triphosphate, allosteric fashion, conformational change, or tyrosine kinase. If we talk about interstitial lung disease, that causes are smoking related, idiopathic pulmonary fibrosis, occupation related, or hypersensitivity pneumonitis. Treatment: in medications, we go for corticosteroid medications or the medications that slow the progression of idiopathic pulmonary fibrosis, or medications that reduce stomach acid. If we talk about corticosteroid medications, that we have prednisone. Medicines that slow the progression, we have pirfenidone and nintedanib. Medications that reduce stomach acid, so we have estroreceptor antagonist or protein pump inhibitor, in which we include omeprazole or pantoprazole, etc. Treatment also include oxygen therapy, pulmonary rehabilitation, and surgery. In oxygen therapy, we make breathing and exercise easier. Let's talk about pulmonary rehabilitation. It has physically exercise to improve your endurance, emotional support, nutritional counseling. Surgery is the last option, in which lung transplantation occur. If we talk about case study, now we talk about case study, which has means subject, object, assessment, and plan. So gender, it has gender male, age 25 years, location lungs, shift complaint, yes, it has increasing cough and dyspnea, patient history, non-small cell lung cancer, current therapies, it is going through chemotherapy and radiotherapy with erlotinib 150 mg orally. It has white blood cells 6600, ESR 30, and electrocardiogram and electroechocardiogram are also normal. If we talk about assessment, it has dyspnea in a patient with NSCLC include infection, cancer, progression, pulmonary embolism, that is interstitial lung disease. Plan: first we give Asbrit and nintedanib, which slow down the rate of interstitial lung disease. It can surely give myofilonic mofetil. In the end, we go for lung transplant, which is the last option. Thank you.